from the different speakers tonight and their groups and what they're doing to improve community health and building resilient, inclusive communities here in Greensboro. I would also like to echo the thank you to Holy Trinity for allowing us to use this beautiful space this evening, and also to Lyndon and Cometa for all your work in organizing this, and also for co-hosting this. So thank you. And also for all of our speakers, I think everybody's over there. Thank you for being here. Thank you for the work that you do in lifting up the health in our community in your different ways. And for everyone else, we're delighted that you're here and look forward to connecting with you and discussing different ideas after we're all done with this meeting. I'm going to be honest here. I did not get this timed out under 7 minutes, so if I see anybody nodding, I'm going to say that's 7 and I'll stop. Okay. Well, I'm Beth Mulberry, and Mustard Seed Community Health is where I spend most of my time nowadays, where I serve as the medical director and physician. I wanted to kind of talk about a couple of the broad ideas or broad thoughts about the idea of mustard seed and the need for mustard seed when it was being developed. For me, so these are going to be more of my personal thoughts. I'd say a lot of things were important in why I thought mustard seed was important to bring about. But for me, 2 things stood out. The first thing was just love of community, and the love of the community that I experienced growing up. And then also what I kind of call curiosity winning over fear. And I think sometimes you can call that love even for other people. So just to kind of put you where I grew up, how many of you remember getting on the phone tree and calling up all your buddies and saying, let's meet at the baseball field or whatever you were going to do, and you all show up Sunday afternoon, lazy, just, picture the lazy summer afternoon, everybody's back from church or wherever, and you play and run around and you could do it until the street lights came on. And you could do that because it was safe. And no adults were around with us either. They had to learn how to socialize as kids, and no smartphones either. And so this was a place where you knew your neighbors and everybody checked in on each other. I was blessed to grow up in a place like that, and I just really feel like everyone should have that experience, that kind of community. The community where I grew up, however, did not have much diversity at all. Everybody pretty much looked like me. We were all short. Somehow, through my parents and siblings, we didn't really develop what I consider to be a fear of people that look different from us. We had this curiosity for some reason, and I'm sure it rubbed off from my parents, curiosity about just these marvelous differences in the traditions that other people have, their cultures, their foods, their dress. It really started for me, my memory was, I was like the only Protestant in the town of German Catholics, and everybody was going to catechism, and there was just this wonderful mystery to me about what that meant with their religion. And then I went to college, and my Jewish friends, the same thing, and I wanted to learn more about it. It didn't scare me, I wanted to learn more about it. And then, that just continued as I learned about people from other states and how they grew up, and people from other countries. Okay, so I'm not really good with transitions, and I'm told, again, that I have to get this done under a certain amount of time, so stay with me with the transitions. So I grew up, and I went to school for a very long time. They let me out when I was about 30, and somehow I ended up in the bush of Alaska taking care of Yupik Eskimos, who somehow were still taller than me. And my dreams of being a center on the community basketball league were dashed as soon as I walked on the floor, and I realized I was still the shortest one on the court. Anyway, we served 50 Eskimo villages, some of which were 200 miles away by planes that were held together mainly by duct tape that's flat by your head, as you were doing things like medevacing a woman from a village who was in labor and the baby's in breech position, and you've never delivered a baby in breech position before. And so these planes, as you can imagine, led to a lot of praying for many different reasons. What I did learn there, though, with my time up in Alaska was other than I don't like seal meat dipped in fermented seal oil to eat. The concept that they had developed over the years that they called health elites. It was hard to get to all those villages. Lots of villagers wouldn't get their kids vaccinated because historically the white man had brought disease to their communities, which led to a lot of death. And they were afraid, for good reason, that we might be weakening their people with our Western medicine. So they came up with this idea to train the medical folks. They came up with this idea, and the community. This was working with the community. I wanted to be sure I say that too. They started training a few people from each of the villages on basic evaluation and treatment of injury and illness. They even developed their own health centers where these evaluations took place. They trusted their own, the people that they knew. And the doctor assigned to the village would call out. So we were in a hospital outpatient complex. The doctor assigned to that village would call out every day after lunch and go over their evaluations and plans. And I can tell you, it worked really well. Okay, so here we go with another bad transition. Flashing forward to Greensboro, North Carolina, many years later, spring of 2013, we're over here at a volunteer clinic once a week. And at the same time, Mustard Seed was just a planning committee, and we were working toward becoming a nonprofit board. One of the things we did purposefully was leave clinic out of the name. And this is where we start talking about the community part more. We wanted the focus to be more on the health of the community. Yes, we were going to be providing, we would be the place where we had the integrated primary medical and behavioral health care, and that's a really important part that I wanted to put in there, is we feel that the mental health part is just as important as the physical health, the medical health. But even though we were going to be the providers for the access to that health care, we really felt strongly that we needed to focus on the broader health of the community. And so I've lost my place in my notes here, so bear with me just a second. So certainly access to quality and affordable health care is part of living a healthy life. But the day-to-day things that we now lovingly call social determinants of health, healthy and affordable housing, access to food, access to good education and job opportunities, that outdoor physical activity where you can just call your buds up and go play. Those are really the things that make a bigger difference in whether we live a healthy and long life. And so as a healthcare provider in the community, we can't do all of those things. So we rely on the different service groups that we partner with to help us provide or help us lift up those things within our community. And that's basically the idea behind Mustard Seed Community Health. There was another point I wanted to make here. The other point I wanted to make with regards to the community is that we wanted to be in the community we serve, and this is one of those barriers of social determinants of health is transportation as well that I didn't mention. We wanted to be in the community we served, and we wanted to be part of that community. And so all of this working together, finding out what the community needs, and from the people in the community, and then working with those different resources. Okay, back to the health aid concept from my time in Alaska. So in the East Greensboro neighborhood of Cottage Grove, where Mustard Seed is, it's pretty diverse. So how do you develop the trust to work with individual communities, from born and raised in Greensboro, North Carolina, to those from all over the world, with different languages and cultures, and find out what those residents need to live those healthy lives? And our answer is what we call the Health Outreach Team, or HOT Team for short. Now, I don't know if Kojo is going to be watching this. Kojo Minta is a young man who's a graduate of the Public Health Program at UNCG, and he made this really great computer-generated diagram of this really awful rudimentary drawing I had. So I don't have it to post with you this evening, I'm sorry, but I'm going to be referring to it. So the Health Outreach Team, the main folks in the health outreach team or the community health worker. So if you think of a wheel with the I'm sorry. If you think of a big wagon wheel with the big center hub and the spokes going out, and then the wider wheel on the outside, that's the diagram for the health outreach team. And in that center are the leaders, and they are the community health workers. And the idea with them is that they are the ones going out into the community and finding out what the community needs are and what works to get those things in place. And they're the ones that are building the trust, just like those health aides did. It's not just about access to health care. In fact, that's a very minimal part of what our community health workers do. Dulce's here. She's taking over the health outreach team shortly. And we have some long-term community health workers, Joanne and Gloria, and they just do this phenomenal job of pulling people in and taking care of them as well. And a lot of it's food deliveries, a lot of it's transportation, getting people to get their vaccines, especially during the pandemic. Those are the bigger things that they do, not just bringing folks in to be seen at the clinic. So they're in the center there at that hub, and they're developing the trust. And the idea also is that we find somebody that looks like all the different villages within our community to develop that trust. And when they see when one village sees one community health worker that represents them working with another community health worker from another village, then they develop trust in between their villages, and so on. And that's an even bigger part of that central hub. And then we have the university interns that are in there with them, kind of on the rim of that hub. And the way we've got it drawn is nursing, social work, public health, and nutrition. And we've had those interns with us on and off all along. We really have the social work folks with us. And so they are letting the community health workers know what they can do within their own disciplines. And the community health worker is letting them know, yeah, that's not going to work. We've tried that before. Why don't we try it a different way? Which is what you really need to know when you're working with communities. And then the students get to work with each other interprofessionally. And that's in real time. I mean, they're doing it in their internship. And in learning those skills that it takes to work together, and then they take it back to their universities, and hopefully we might change some curriculum based on what we're doing. So, and one other point I want to bring, I am also the physician, I should say the physician at Mustard Seed is also part of the health outreach team, as is very importantly our licensed clinical social worker. We do a lot of mental health care. If you can imagine growing up in poverty, which a lot of our patients have, there is a lot of trauma, and we so rely on that mental health piece as well. So, and then, that outer scope that is all the university folks and like New Hope Community Development Group and Greensboro Housing Coalition, all those services that we utilize that surround us to work to help our community get the needs taken care of that they have. So I look forward to hearing everybody else speak tonight and speaking with you afterwards, and hopefully coming up with some really grand ideas. Thank you.